We are streaming live on YouTube right now.
We are having a second series of webinar on Women's Day. Today we have Dr. Diksha P. So it's a great pleasure to introduce her today. So she has done her MBBS from Goa Medical College in 2014, and she has done her master's in 2018. She has done a fellowship in aesthetic dermatology from Skin City, Pune, observation at CMC Vellore in Department of Dermatology. She has got some academic achievements like publication of article in National Peer-Reviewed Journal, and paper and poster presentation was done in at National Dermatology Conference. At present, she is working as a consultant dermatologist at Pednekar Clinic, Mapsa, and she is a visiting dermatologist at Redkar Hospital, Pednem, and Dukle Hospital, Kandalim. So over to Dr. Diksha. You can start with your presentation.
Thank you, Dr. Riddhi. Thank you, Dr. Neha, Dr. Mamta, for having me today. It's a great honor to be present and speaking here, and a very happy belated Women's Day to all you ladies, wonderful ladies out there. So on this occasion, I've chosen the topic of skin issues at different stages of life, and we'll start with it without wasting any time. So can you all see the screen?
Yes, ma'am.
Hello. Is it visible?
Yes, we are able to see the screen, ma'am.
Okay, fine. So why this topic? Because as we grow, as we mature from a baby to young and elderly, our skin also changes. It changes its texture, it changes its composition. And that is why skin care is different at different ages. Okay, so yeah. I've divided this into three main segments, that is skincare of a newborn, skincare of teenager and how beauty standards affect teenagers, and skincare in pregnancy, and some tips for elderly. So how skin of a newborn is different. Skin of a newborn is 40 to 60 times thinner and less hydrated and has reduced moisture, natural moisturizing factor compared to an adult skin. It is more vulnerable to thermoregulation. There is increased skin permeability and increased transepidermal water loss. So here you see two different skin. This is adult skin and this is baby skin. Here, the outermost layer, what you see, can you see the pointer as well? Yeah. The outermost layer which you see is a stratum corneum, which is the outermost layer of the skin. In an adult skin, you see that the corneocytes, the skin cells are tightly bound. And that is how it forms a barrier from the external to the internal. It doesn't allow anything from inside to go out or anything from outside to go inside. While the baby skin, you see the stratum corneum is much, much thinner and the corneocytes are sparsely present. So here there is more transepidermal water loss. So the water from inside can go easily outside. Also, whatever is there outside can easily penetrate inside and cause more allergies and more reactions. So that is how baby skin is different. So a neonatal skin is measured based on the based on parameters like dryness, scaling, erythema, color, texture, physiological changes, and this is termed as neonatal skin condition score. And this score helps in assessing the risk of dryness and barrier function that we just saw. Immaturity of skin, phototherapy, iatrogenic injuries, extensive epidermolysis bullosa, it's a blistering skin condition, septicemia, and environmental temperature leads to dryness. This is the neonatal skin condition score, which is present here, and these are the factors on which it is calculated. Moving on to the next slide. Coming to skin care. So WHO recommends that soon after birth, baby is placed on the abdomen of the mother before the cord is cut, or even on the chest after the cord is cut, after which the entire skin and hair is wiped with a dry warm cloth. It is strongly recommended that baby is dressed only in a diaper be left on mother's chest, with both of them being covered with a pre-warmed blankets for at least 1 hour after birth. This will help promote breastfeeding and prevent hypothermia. This is what we just saw, kangaroo mother care. And so it is used mostly in preterm babies or low birth weight babies, which are at higher risk. I'll give you a brief history about kangaroo mother care. It was first discovered in Colombia. It incidentally happened so that in a hospital, Colombian hospital, it was a high flow hospital. There were around 11,000 deliveries happening every year, and they didn't have enough incubators to keep the babies warm. There were many low risk, high risk babies and all. So what they started doing is they started putting the babies on mother's chest to keep the baby warm. They started asking the mother to hug the baby, and it turned out so that those babies who received kangaroo mother care had better survival rate. They started feeding faster and they started putting on weight faster. So yes, there are certain factors which, other than hormones, pheromones, medicine can't explain, and that is what we call the mother-child bond. Coming to vernix caseosa and bath. Vernix caseosa is a natural cleanser and moisturizer known for its anti-infective, antioxidant, and wound healing properties. WHO and European Round Table meeting recommend that vernix caseosa should not be removed because of various beneficial functions. So vernix caseosa is basically this whitish coat that is present on the baby. It is basically the keratinocytes, the dead cells, dead skin cells, sometimes hair, along with intrauterine fluid, which forms a thick layer on the baby, and it should not be wiped off because it has all these beneficial functions. WHO recommends that the first bath should be delayed until 24 hours after birth, but not before 6 hours. Duration of bath should not exceed 5 to 10 minutes. Routine bathing of a newborn and infant is mainly need-based and depend on the region, culture, and climatic conditions. So there's no fixed number of times the baby has to be bathed in a month or nothing like that, depending on how the environment, dry, this depends on that. Coming to the most important part of baby care is diaper area. Diaper area is exposed to excessive hydration, maceration, occlusion, and friction, and has increased pH due to the action of fecal ureases on urea. Moistened cloth or cotton ball soaked in lukewarm water could be used to clean the area after defecation. Diapers should be changed frequently in order to prevent diaper dermatitis. Duration could vary from every 2 hours in neonates to every 3 to 4 hours in an infant. Cloth napkins are preferable. Frequent exposure to nappy area to air would be beneficial. If frequent change of napkin is not possible, then you could use mineral oil or something. It can act as a barrier. So here we see in this picture is what is candidiasis, the very common site. Here you could see erythematous rash with satellite lesions around in the diaper area, very common in babies. Going to the next slide. Soap, shampoo, talcum powders. The ideal cleanser is one that is mild and fragrance-free with neutral or acidic pH. Does not irritate the skin or eyes. Syndates are preferred in children with skin problems. So Syndate is a synthetic detergent which has a neutral pH. Routine use of powder is not advocated. This is something controversial because a lot of people use dusting powder on the babies while after bathing them, but it is not, in dermatology at least, we would not advise to use so frequently. In case of infants, if desired, the mother should be advised to smear the powder on the hands and gently apply on the skin of the baby. Puff should not be used because there's always a chance of accidental inhalation. Powder should not be applied, especially in the groin region, and especially in girl child, because it is said that these olden powders used to have asbestos in it, and asbestos is a carcinogenic agent for cervical cancer. So yeah, that is the reason why powders are not very advocated. The next slide, emollients and oil massage. So as we've seen, dry skin is very common in preterm babies, also postterm babies, IUGR, intrauterine growth retardation, neonates under warmers, those who are kept under warmers, incubators, phototherapy, and in children with skin conditions like atopic dermatitis, ichthyosis, dry skin, psoriasis. So this dry skin leads to micro and macro fissure formation, which results in easy penetration of allergens. Here we've seen that I've explained you skin barrier. Here we correlate skin barrier as a brick and mortar model. That is what we call, where the corneocyte forms the bricks. Here in this diagram you can see the corneocytes or the skin cells form the brick, and the material in between forms a mortar or the cement. So that is how it forms a barrier between external and internal. In dry skin, this barrier is broken, and that is why easy penetration of allergens, bacteria is possible. Hence, the use of emollients is very important in order to restore the barrier integrity and prevent infection and further damage. Coming to oils for massages, natural olive oil and mustard oil have been used for many years as an emollient, but studies have shown that these oils disrupt the skin barrier and hence should not be used. While vegetable oils are high in linoleic acids such as safflower oil or sunflower oil are recommended for infant skin. Also, coconut oil is very, very good for baby skin. Skin barrier recovery occurs faster with sunflower oil seed, petrolatum, and coconut oil, whereas it gets delayed with mustard oil, soybean oil, and olive oil. So they say that the seed oils basically that delay skin maturity, while vegetable oils like safflower, sunflower, and coconut oil is better. Coming to benefits of massage, massage promotes circulation, suppleness, relaxation of different areas of body and tones the muscle. It relieves physical and emotional stress in the baby and supports the baby's ability to fulfill the individual development potential. Massage increases the activity of vagus nerve, which in turn increases level of gastrin, insulin like growth factor 1, and that enhances food absorption and weight gain. There is greater bone mineralization, more optimal behavioral and motor responses in infants who were given massage. So overall, to summarize, massage of a baby does have a lot of beneficial effects in different perspectives, and massage has to be done. It is highly recommended. Coming to the next section of the topic, and this basically I chose because nowadays everything is online. With COVID, the whole world, all conferences, even lectures are online, and to the point that especially for teenagers, it is difficult to face themselves on camera without using filters, without using any makeup. So that's the reason why I chose this topic, especially for teenagers. There is this social pressure to look a certain way, and this has not been just now, but ever since there have been beauty standards, and throughout history these beauty standards have meant radically different things for different society. If now we look back at it sounds very stupid and silly. So here in the first picture there are cosmetics from Victorian era which contain mercury, lead, arsenic, ammonia. This was so toxic that people would get ulcers on their face, but they would still continue to use toxic products like this. Japanese women considered black teeth as a sign of beauty, while this is a picture from a Greek lady, and they said that unibrow was a sign of paramount beauty. Here, so these social standards put an immense pressure to look a certain way, leading to stress, anxiety about minor flaws and imagined imperfections. So minor pimple or a zit or just a black spot, or the teenagers would be worried about. Not just teenagers, even young adults, even adults for that matter. And this is called as body dysmorphia. This section I've taken from news article where Dr. Ileana D'Cruz, a Bollywood actress, she confessed that she suffered from body dysmorphic disorders, and she revealed that how therapy helped her. She was suicidal at a point, and this she revealed in an article in the newspaper. This picture, we know Michael Jackson, he underwent around 100 or more than 100 surgeries to change his appearance, to change the shape of his nose. And the last picture here in the corner is how he would have looked if he had not undergone those surgeries. So that is the extent of societal pressure. The fad of appearing better just worsened with advent of cameras and editing. In the last 5 years has seen a blooming business with filters, photo editing apps, and modifying images is not restricted only to billboards and magazines. Everybody has it on their phone now. You can just click and change the way you look. So Dr. Neelam Vashi described the term Snapchat dysmorphia, wherein the patient wants to alter his appearance as per their Snapchat filter. They want to look like the Snapchat filter. This is one project that was done by a photographer named John Rankin, who was a British photographer. So he selected random 15 teenagers and he asked them to edit their pictures to make them more social media friendly. And the results were surprising that these children changed so many features. So they thought that this, to make it like social media friendly, to make it acceptable to be put up on social media, they changed their eyes, they changed their nose, they changed the shape of their lips. And these results were shocking because it is to a dangerous level. So what we can do, we can include something called as inclusive beauty in our lives. This concept states that everyone is beautiful in their own very way. This is a picture of a Canadian model, Winnie Harlow, with vitiligo. So in spite of that, she's a supermodel. This is Claudia Diop. She's again a supermodel and she was being teased for her color. She's now termed as melanin goddess. Here there is heroes pledge for advertisers. This states that this pledge states that the advertisers are not allowed to change the color, shape, or proportion, size, anything about a model after the after the photo is taken. So they accept that this changes has an impact, mental impact on the children. So that is heroes pledge for advertisers. Coming to the next section of my topic, that is pregnancy dermatosis. So during pregnancy, there is huge changes, immunological, metabolic, endocrine, vascular, on a pregnant woman's skin. And this, not just skin, but all the hair follicles, sweat glands, these are both physiological and pathological as well. They have been classified into 3 major sections: the physiological skin changes, specific dermatosis of pregnancy, and skin diseases affected by pregnancy. Coming to pigmentary changes. So during pregnancy, there are marked changes in levels of sex hormones, estrogen, progesterone. This leads to changes in skin pigmentation, vasculature, and sweat glands. Most women notice a generalized increase in skin pigmentation during pregnancy, and the change is more marked in women with darker skin types. Areas that are already pigmented become darker, in particular the nipples, areola, genital areas, and midline in the abdomen. Here is the picture. This is called linea nigra. The midline becomes more darker. These pigmentations usually fade after delivery, but seldom to its previous level. In approximately 70% of women, especially those of darker complexion, whereas we get melasma or chloasma, this pigmentation also develops during the second half of pregnancy. Irregular, sharply marginated areas of pigmentation develop in symmetrical patterns, either on the forehead, on the temples, on the side of the cheek. Melasma usually fades completely after delivery, but sometimes may require treatment also. This is because the hormones estrogen, progesterone stimulate this melanocyte stimulating hormone. Melanocyte are the pigment forming cells. A lot of time, especially if it runs in the family, melasma is considered as 100% recurring condition. So yes, it does recur after that. And a lot of time treatment is difficult and sun protection is a must. Coming to hair and nail changes, hair growth on scalp is more pronounced during pregnancy. In the 3rd trimester, the proportion of hair follicles retained in the anagen phase rises. So what exactly happens is, and post-delivery, there is more shedding. Postpartum, this is known as telogen effluvium. Here I'll explain to you the hair cycle in brief. This is the anagen phase or the growth phase. In the first picture you see, the hair is very healthy, thick at the root, the bulb, hair bulb is thicker. Anagen phase is a growth phase during which the hair is growing, and around at a given point, around 90% of the hair should be in anagen phase on the scalp. Catagen phase is a pause phase where hair is neither shed nor growing. This lasts for around 2 to 4 weeks, and telogen phase is the shedding phase, lasts for around three months. So during pregnancy, because all of the growth hormones, the lot more hair go into anagen phase, and the hair grows faster. While after pregnancy, after delivery, most of the hair is shifted to telogen phase, and there is shedding of hair. Spontaneous recovery occurs within 6 to 12 months. The telogen phase stops after 6 to 12 months. Pregnant women often report brittleness of the nail plate, and some develop distal onycholysis also. So here, when you are in postpartum phase or in telogen phase, don't worry. It is a very temporary thing. Just make sure your nutrient supplementation is done, that you're eating well, you're eating healthy. No other treatment other than that is needed. Coming to the next slide. Striae dystocia or stretch marks. Striae dystocia are extremely common in second and third trimester of pregnancy and can arise in up to 90% of pregnant women. They are linear pinkish or purplish atrophic bands that develop at right angles to the skin tension lines. So on the abdomen, breast, thighs, and buttocks. That's basically because skin is stretching and being toned. They are relatively uncommon in Afro-Caribbean or Asian women, and there may be a familial predisposition. So here you see a Caucasian or a Western woman, and here this is an Indian woman, and here you see that it's relatively lesser. Here there is also linea nigra, what we saw in the previous picture. One thing I would like to tell over here, because I get a lot of patients asking for treatment of stretch marks. There are certain creams available, there are some certain oils available, but that is useful provided you use it while the stretch marks are happening. That is while you're pregnant, while the skin is being stretched. Once it has stretched and it has formed a cut, that will not get healed because it's already formed a scar. To repair that, you will need other techniques, other procedures, but creams won't help in that. Creams will help if you apply it while the stretch marks are being formed. A very important point. Vascular changes are thought to be due to sustained high levels of circulating estrogen. Vascular spider nevi are very common in pregnancy and usually disappear postpartum. Palmar erythema is common, the redness of the hand that appear almost in 70% of women. Varicose veins of the legs, hemorrhoids. Hemorrhoids also a lot of people face. That is because of the pressure of the growing baby inside the uterus, which is compressing on the vasculature of the rectum. This is what leads to hemorrhoids. Common complications in pregnancy. A rare but more serious event is development of deep vein thrombosis, which can lead to permanent damage to veins of the legs. So what I would suggest over here is make sure you have good fiber-rich diet. Make sure you eat fruits, vegetables, salad to make the bowel movement easier. Coming to specific dermatosis of pregnancy. So these dermatosis, these skin lesions are specifically present in pregnancy and they're characteristic of pregnancy. So purpuric urticarial plaques and of papules and plaques of pregnancy, also called as PUP. These are polymorphic eruptions of pregnancy, typically starts on the abdomen, often within the striae dystocia, with severely pruritic urticarial papules that coalesce to form plaques. Often eruption remains in the sides, but it can quickly become generalized, spread to other areas. There is characteristic umbilical spreading. Main theories proposed on the abdominal distension and hormonal factors. So here in the next slide, you see they are polymorphic. Polymorphic meaning one is a boil, one is a patch. They mostly start on the abdomen. They start from the striae, from the stretch marks it starts. There is characteristic umbilical sparing. And from there, they spread to the other areas of the body and they're highly pruritic, mostly from the second, third trimester. And they say this is because the stretching of the skin gives out certain factors which causes itch. So yeah, it's initially characteristically present in first pregnancy. Atopic eruptions in pregnancy. This is sometimes in 20% of patients. This is an exacerbation of pre-existing atopic regions. In 80%, it can come as a first-time presentation itself. The pathogenesis is thought to be triggered by pregnancy-specific immunological changes, a reduced cellular immunity or increased Th1 production. So pregnancy does cause changes in the immunity and that could trigger atopic dermatitis. This is a very rare picture, pemphigoid gestationalis.
So this is a condition where blisters develop on the skin after patches, and it is very transient, and it can disappear postpartum. So these are the dermatoses which can be affected or worsened by pregnancy. Most common being fungal infections, candidiasis, vaginal candidiasis, tinea versicolor. So these get precipitated during pregnancy because hormonal influence make the person more sweaty. There is more sweat retention. Also, body folds on the groins, the abdomen pressing on this. So all these factors leads to humidity, maceration, and more fungal infections. Tumors and skin tags. By tumors, I mean tumors are rare in Indians, but skin tags and moles do appear, which are benign, which disappear after later on. They're not malignant. Also, acne gets worsened. Some people do present with new onset acne during pregnancy or exacerbation of previous acne. Atopic dermatitis we've already seen. Okay, so all these things which are either previously present or can be precipitated by itself. Coming to the next segment, and the last segment is skincare in elderly. This topic I chose for this is because, as we've seen, the youngsters' skin, elderly skin also changes. After a certain age, skin feels dry and irritated. There is epidermal thinning, there is loss of dermal collagen, there is increased transepidermal water loss, as we've seen in the previous. Also, the elderly are so much more on medications, they also contribute to the dryness of the skin. Tips for skincare in elderly. Use some soap which is gentle on the skin. Use a fragrance-free cleanser or a body wash. Nothing which has colors in it. Nothing which has strong fragrances in it. Use a mild white soap. Use warm water or not hot water. Use soft cloth. Don't use a loofah. Avoid using something harsh on the soap on the body. Keep your bath or shower shorter. Maybe it should get over in 3 to 5 minutes. Pat water gently, tap it, and don't rub the skin. Immediately after the bath, within 3 minutes, make sure you apply a moisturizer or you apply coconut oil on the body. So this acts like a protective layer. It prevents water loss, making it even more dry. So as we've seen, the skin becomes thinner. The hands and feet also become thinner. The skin of the hands and feet, and that is the reason why elderly women come with all the allergies of the hand, rashes on the hands and all, because they're used to doing kitchen work and they don't realize that the hands have become more sensitive. All the chemicals, mud, dust, garden work, kitchen items like vinegar, garlic, detergents can irritate the skin. So make sure you wear gloves while doing kitchen work, especially your grandmothers, elderly mothers. Tell them to wear gloves, okay, as much as possible. Protect skin from sun. Seek shade whenever you're going out, and from 10 a.m. to up till 3 p.m. Wear clothing that protects your skin, lightweight, long sleeve shirt, wide brimmed hat or sunglasses. Carry an umbrella with you wherever you're going, especially the elderly. So in a hotter climate, the water loss is larger. You would feel tired by the time the elderly person comes back home. They would feel really tired. There are more chances of sunstroke. Go fragrance free, cologne free, no perfumes, no colors as much as possible, no coloring of the hair. So all these reactions are much, much more in compared to elderly skin as compared to a younger skin. Foot care, especially in diabetes, is very important in elderly because more than half the elderly patient would have diabetes. Even if they don't have diabetes, they would have some sort of peripheral neuropathy, vitamin B12 deficiency, which leads to nerve damage. Some people with nerve damage have numbness, tingling, or pain, but around 33% have no symptom at all. You would say living without pain sounds great, but it comes at a cost. That this is body's way of telling you that something is wrong and pull your feet back. But if there are no symptoms of nerve damage or you don't feel pain, you would continue to walk on the same ulcer or same crack, and that would eventually lead to a bigger ulcer or at times even gangrene. So check your feet every day. Once you come back from home, make sure you examine your feet for cuts, thorns, redness, swelling, sores, blisters, calluses, anything. Check your feet. Examine it. Keep a mirror in front of your feet or ask a youngster to have a look at your feet. Wash your feet every day with warm water and apply a lotion from top to bottom. Avoid using it in the wet spaces. There it can cause infection. Never go out, step out without wearing a sandal. Even if you don't have nerve symptoms, especially your elderly people, never let them out without a sandal. Never go out without a bare. Wear shoes that fit well. Try new ones at the end of the day. Why? Because at the end of the day, their feet would be swollen and you would have a best fit sandal. Break in your new shoes slowly, 1 hour every day. What do? You'd wear your new sandals, keep walking for an hour, remove them off. Use your older sandals again. Again, the next day you'd wear them for 1 hour, and until maybe a week or so, they'll fit exactly the way your foot is, and then you discard the older ones. So slowly, gradually you use the new ones. Trim toenails straight across and gently smoothen sharp edges. Don't cut them too much inside the toenails. Keep blood flowing. Put your feet up, wiggle your toes if you've been sitting for a long time. So to summarize, skin changes certain properties with age, and hence it is essential to change skincare routine accordingly. The appearance does have an impact on person's psychology at teenage more than others, and that should not be ignored. Pregnancy can affect skin in multiple ways, although most changes are reversible. Some can be dangerous for the mother and the baby and have to be looked out for. Okay, so that's all from my side. Any questions? Am I audible?
Yes, you are audible, ma'am. There are
Yeah.
multiple questions in the chat box. I would request Dr. Riddhi and Dr. Palasha to go ahead.
Thank you so much for the webinar, Dr. Diksha.
You're welcome. You're welcome.
In the chat box in the webinar, a couple of questions have arisen. So the first question is Vaseline advisable for baby skin?
Vaseline petroleum jelly. Yes, yes. So basically, your moisturizers come from range differently, like lotions. Lotion is more watery. Creams are more thicker. They have a little bit of oil component. Vaseline petroleum jelly would have more petrolatum, like more of a oil component. So depending on the climate, if you're in Goa, I would advise you to use something like a lotion or coconut oil, something which is more watery, because it's so humid out here. If you're in a drier climate, somewhere like Pune, Bangalore, or even drier, somewhere Rajasthan or something, yes, I would advise you to use something thicker like a cream or petrolatum, depending on the external atmosphere. If it's dry, you use a thicker cream. If it's humid, you use a lotion.
Thank you, doctor. So the next question is, for how many days should the coat on baby skin not be wiped after birth?
Till 24 hours. That's what they say. The first bath should not be before 6 hours. Like if some people need to do it according to their culture and all. So at least not before 6 hours. You can keep it for maximum 24 hours.
Thank you, doctor. Next question is how to avoid pregnancy acne?
Pregnancy related. So what happens is because of your hormonal changes, new acne come on your face. If you've been having acne before pregnancy, then there is a chance that it would continue after pregnancy also. But if you've developed it only during pregnancy, then believe me, once your pregnancy is over, it should go down. Otherwise, a small course of antibiotics should be able to take care of it. But if you've been having it before, then you would require treatment after pregnancy. There are certain medications which are not allowed to be given during pregnancy. So we cannot give you medications or treat your acne during pregnancy. To avoid as such, I would say use a salicylic acid cleanser. Something, if your face is too oily, use something with salicylic acid cleanser or glycolic acid cleanser. That would open up your pores. There are acne creams available. You can just apply spot acne to keep it in control. Take an opinion of your dermatologist. They would be able to guide you better depending on the type of acne you have.
Going on to the previous question, is tretinoin advisable for pregnancy acne?
No, tretinoin is strongly contraindicated because especially there are two types now, oral tretinoin, which you take tablets, or topical tretinoin. Oral tretinoin is strongly contraindicated because it can cause deformities in the baby. Even topical tretinoin is contraindicated because there's a chance of systemic absorption. So strictly no, tretinoins are not advised in pregnancy.
Thank you, doctor. So the next question is, what care should be taken for skin during pregnancy and in adolescent age group? Any daily routine skincare tip during changing weathers?
Yeah. So so two different questions: pregnancy and young age teenagers. For pregnancy, because there are hormonal changes happening, you would realize that you're sweating a lot, you're feeling hot. You can shower twice a day in summer seasons, especially. You can apply a moisturizer on the external surface, on the hands, legs, on the regions under the breast, especially where there's sweat accumulation, under the belly where there is sweat accumulation, in the groins. They you could use a little bit of talcum powder, little bit, not much, to keep that area dry. Overall, I would say shower twice a day, okay, and use some moisturizer on the hands and legs. For young adults, only if there's some specific skin condition like acne, dandruff, or hair fall, that needs to be treated. Otherwise, regular sunscreen, moisturizer, face wash should be more than enough.
Thank you, doctor. The final question is, Shama Khan asks,
Yes.
know the cause of vitiligo and how to prevent in the early stage.
So vitiligo is an autoimmune condition. Okay. Autoimmune meaning when your own immunity can't recognize your own cells. It's like, for example, your Indian police say tomorrow starts killing your own Indian people. They can't recognize this. This is not a terrorist. It's our own Indian people. It's the same way your own immunity, which is your defense, can't recognize that these melanocytes, the melanin containing cells, are our own body cells. They think they are some bacteria or virus and they start killing it. That is what vitiligo is in brief. So there is no way you can prevent it. You can treat it wherever there is a patch. There will be creams available which you can apply, and it will go away. But there's always a chance that it will come back. Say tomorrow you get some viral infection, you get COVID or something, your immunity will rise. Once your immunity rises, the immune cells will increase and they'll kill even more melanocytes. So it is relapsing and recurring condition. It can come and go away throughout your life. One thing which I tell my patients is, vitiligo by itself will not damage your internal organs. It will not bother you anyway. You can lead a very happy and healthy life, even if you choose not to treat vitiligo. Because if you choose to treat it, there are a lot of factors. It can affect you psychologically also. Even the medicines which you're taking can be harmful to your liver, kidney. So yes, vitiligo is a condition which is recurring and relapsing. It is harmless to your internal organs. Nothing will happen. You can lead a happy life with vitiligo. Just that society considers it as a bad condition. It's not contagious either.
Thank you, doctor. So with that, the question and answer session is over. I would like to give the vote of thanks for today's webinar. Thank you so much for today's speaker, Dr. Diksha P, Pednekar, for this beautiful webinar conducted and very informative on a different stages of our life. Thank you for the beneficial explanation.
Thank you so much, Dr. Palasha. Thank you, IAP, for having me here. It was an honor to do this. Thank you once again.
Thank you so much, Dr. Diksha ma'am. Thank you, Dr. Riddhi and Dr. Palasha, for conducting and organizing this pleasant webinar on Sunday morning. And it was really a nice topic chosen. From my side, Dr. Neha Singh Mandare. I am also a sub-coordinator of Latur District, Maharashtra from IAPWC team. And I'm also a member of in IAP Digital Media team. I would like to thank all of you for being here for today's webinar. And it was a very informative session with interesting question and answer also. So, and also, Doctor, I would like to thank Dr. Smrnika for organizing this. Yeah. So have a nice day, all of you.
Have a
Thank you.
Thank
beautiful
you
week.
once again.
Thank you.
Thank you so much, Doctor. Thank you.